Welcome back to HealthCap Weekly Wrap, your trusted source for the stories shaping senior living care. Whether you're catching a quick break or winding down your shift, we've got the headlines that matter, all in one place.
This week, we're starting with a big one. Can we actually prevent dementia? One expert says yes, and we'll talk about what that could mean for resident care, staffing priorities, and long-term planning.
We'll also dig into how older adults really feel about Alzheimer's screenings and new blood biomarker tests. Some of their answers might surprise you. And later, we'll introduce you to Kathy, an AI companion who just might change the game in memory care.
We're covering new tools like the MDS-specific Frailty scale, an FDA approval that's shaking up diabetes care, and a trauma-informed care resource that every community should know about.
And stick around. There's a live HealthCap webinar coming up on root cause analysis, and it's packed with takeaways you can actually use. Let's get into it.
Ready for the first story?
First up, a big picture question with real implications. Is dementia actually preventable? According to a recent commentary by Dr. Joanne Manson on Medscape, the answer might be yes, at least in part. She says up to 40% of dementia cases could be delayed or even avoided altogether by focusing on modifiable risk factors.
And these aren't rare or niche risks. We're talking about things communities are already monitoring. Things like blood pressure, diabetes, physical inactivity, obesity, smoking, depression, even social isolation and hearing loss. The takeaway here is that dementia prevention isn't some abstract goal. It's embedded in everyday care.
One thing that really stood out: hearing loss. It doesn't always make the dementia conversation, but it should. Ensuring hearing aids are working properly, making sure residents are engaged in conversations, and addressing any early signs of withdrawal. All of that can play a role in cognitive health.
What's powerful about this perspective is that it shifts the focus from how do we treat dementia to how do we delay it. And for senior living communities, that opens the door to some very practical changes. Encouraging regular walks, organizing social groups, offering balanced meals, all those things could be helping residents in more ways than we realize.
It's also a good reminder that these preventive strategies don't fall on one person. Everyone contributes, whether it's a nurse doing a blood pressure check, a caregiver taking time to chat during lunch, or an activities coordinator designing programs that keep people moving and mentally stimulated.
There's no single solution, but the evidence is clear. With what we already know, we can make a meaningful dent in the projected rise in dementia. And that's good news for residents, for families, and for the entire senior care community.
Let's stay on the topic of dementia for a minute, because while prevention is one piece of the puzzle, detection is another. A recent study published in Alzheimer's and Dementia looked at how older adults feel about routine cognitive screening and blood biomarker testing for Alzheimer's disease.
And the results were really interesting. Most older adults surveyed actually support regular cognitive screening during primary care visits. That might come as a surprise, especially considering how many people associate cognitive testing with stigma or fear. But in this case, respondents seem to understand the value of early detection, especially when it's done respectfully and as part of a routine checkup.
Where things got a little more complex was around blood biomarker testing, the kind of testing that could potentially detect Alzheimer's years before symptoms appear. A lot of people were curious, even interested, but also had concerns. Things like, what would I even do with this information? Or, could it affect my insurance coverage or how people treat me?
Those are valid questions. The study really emphasized how important it is to pair testing with clear communication and counseling. People want to know what their options are, what a result actually means, and how to emotionally prepare for that kind of information.
And it's not just about the person being tested. It's also about families and care providers. If we're going to move toward more proactive Alzheimer's screening, we need to make sure the entire care network is informed and supported. That includes everyone from the primary care physician to the resident's closest caregiver.
For senior living communities, it's a reminder that conversations about dementia shouldn't start at crisis points. Residents and families want transparency, they want options, and more than anything, they want to feel like they're part of the decision-making process.
This kind of research reinforces the importance of building trust early, having those hard conversations, and creating a culture where residents feel empowered, not blindsided by their health journeys.
Now that we've talked about early detection and resident perceptions, let's look at what the future of dementia care might actually feel like. A recent article from Provider Magazine spotlighted a pilot program using an AI companion named Kathy in 6 memory care communities in Oregon, and the results were surprisingly human.
Kathy isn't a robot sitting in a chair or rolling through the hallway. She's a voice-enabled digital companion. Think of her more like a friendly, ever-present presence on a screen. Built by CloudMind software, she uses advanced AI, including natural language processing and sentiment analysis, to hold conversations, respond to emotion, and even mirror facial expressions in real time. She's not just there to talk, she's there to connect.
Over a 65-day period, 18 residents with dementia interacted with Kathy daily, nearly 48 minutes a day on average. That's real, sustained engagement. And it wasn't just casual chatter. One resident with mild dementia and anxiety experienced a 50% drop in anxiety episodes during the pilot. Kathy helped ease stress by offering comfort, predictability, and companionship, all in a personalized way.
But Kathy's impact didn't stop with residents. Behind the scenes, she also generated daily reports for caregivers. These summaries flagged changes in mood, highlighted emerging health concerns, and even suggested supportive interventions based on patterns she picked up during conversations. For busy caregivers, it was like having an extra set of eyes and ears, ones that never missed a thing.
And for families, Kathy added a new layer of insight. Through shared summaries and video call features, loved ones could stay connected and informed about how their family members were doing, not just physically, but emotionally too.
Of course, there are still questions. How do we handle privacy? What happens when families expect too much from AI? And how do we train staff to use this tech effectively? Those challenges are real. But this pilot proves something powerful. AI companions don't have to replace the human touch. They can enhance it, especially in communities where time and staffing are stretched thin.
In Kathy, we're seeing what's possible when technology is designed to care, not just compute. And that might be one of the most promising steps forward in memory care yet.
Switching gears now to a different area of care, diabetes. The FDA just approved Marilog, the very first rapid-acting insulin biosimilar in the US, and it's a pretty big deal for accessibility and affordability.
Marilog is biosimilar to Novolog, a fast-acting insulin that helps control blood sugar spikes during meals. What makes this approval stand out is that it adds a rapid-acting option to the short list of insulin biosimilars already on the market, most of which until now have been long-acting. Marilog joins Semglee and Resvoglar as the third biosimilar insulin approved in the US.
Administered just like Novolog, 5 to 10 minutes before meals, and comes in both a single patient use pen and a 10 milliliter multi-dose vial. The FDA based its approval on the Gemelli-1 trial, a 26-week study that showed Marilog performs just as well as its reference product in terms of safety, effectiveness, and even immune response.
The details come from an article in MedPage Today titled FDA OK's first rapid-acting insulin biosimilar for diabetes, which breaks down the full story behind the approval and what it could mean for people living with diabetes.
The real win here is access. As a biosimilar, Marilog could help drive down insulin costs and give residents, especially those managing diabetes long-term, a more affordable option without compromising quality. And for communities supporting residents with both type 1 and type 2 diabetes, more flexibility in formulary planning is always welcome.
It's also a good reminder to stay on top of med changes. If Marilog becomes widely adopted, medication lists, training protocols, and pharmacy partnerships might need to adjust. So keep an eye on this one. It's not just another insulin, it's a shift in the diabetes care landscape.
Let's talk about a tool that can help assess something we all know is important, but sometimes tough to measure: frailty, especially in residents with complex conditions like myelodysplastic syndromes, or MDS. That's where the MDS-specific frailty scale comes in.
This clinical calculator, featured on Medscape, helps providers evaluate frailty in older adults diagnosed with MDS using a range of 17 variables. It pulls together everything from BMI, fatigue levels, and cancer history to lab values like creatinine clearance, white blood cell count, red cell distribution width, ferritin, and even a 4-meter walk test. It even asks whether the resident can prepare meals independently.
What's unique here is that the tool was validated using real patient data from a registry of over 400 adults with MDS. It groups individuals into 5 frailty risk categories, with survival outcomes that differ significantly, some measured in months, others not reached at all in the follow-up period.
This kind of stratification can be incredibly valuable for senior living communities trying to anticipate decline, tailor care plans, or talk with families about prognosis. It's not meant to replace clinical judgment, but it adds another layer of insight when you're trying to understand what level of support a resident might need, and how soon.
For care teams managing residents with cancer or complex blood disorders, this scale offers a data-informed way to look at frailty not just as a gut feeling, but as a measurable, trackable concern. And that can make all the difference in how we plan ahead.
Let's shift from clinical tools to culture change. Trauma-informed care isn't just a buzzword. It's becoming a cornerstone of how we support both residents and caregivers. And if your community is looking for guidance on how to do this well, the Trauma-Informed Care Toolkit from Virginia Commonwealth University is a must-see.
The toolkit is completely free and designed specifically for long-term care settings. It walks through 6 core principles of trauma-informed care: safety, trustworthiness and transparency, peer support, collaboration, empowerment and voice, and an understanding of cultural, historical, and gender factors. It's not just theory, it's a roadmap.
One of the most practical aspects of the toolkit is how it breaks the work into 3 focus areas: resident wellness, workforce wellness, and organizational wellness. For residents, it offers strategies to recognize trauma symptoms and tailor care with empathy and flexibility. For staff, there are training modules, resources on compassion fatigue, and exercises to build resilience. And at the organizational level, there are self-assessment tools and planning guides to help embed these principles into policy and everyday practice.
There's also a section called Toward Healing that goes a step beyond trauma-informed care, encouraging practices like mindfulness, deep listening, and even community rituals that promote connection and recovery. It's about creating an environment where people don't just manage trauma, they can grow from it.
What's powerful here is that this toolkit doesn't expect perfection. It meets communities where they are and gives them tangible, achievable steps to move forward. Whether you're a nurse, administrator, or caregiver, there's something in it for you.
And in a time when stress and burnout are running high, this kind of thoughtful, compassionate approach is more important than ever.
Let's wrap things up with something that brings all of this week's topics together: action. HealthCap is hosting a free live webinar on root cause analysis on May 13th, 2025. And it's designed to give senior living professionals the tools they need to investigate incidents thoroughly and learn from them effectively.
This isn't just a surface-level overview. The webinar dives into the 5 steps of the RCA process with practical examples you can relate to. It also introduces the 5 whys technique, a simple but powerful method for drilling down into the true source of an issue, not just the symptoms.
One of the key goals of RCA is to shift the mindset from blame to understanding. It's not about pointing fingers. It's about figuring out what happened, why it happened, and what can be done to reduce the chance of it happening again.
The session will be led by Robin Hillier and Angie Sumlinsky, both well-known in the field, and it's accredited for continuing education through both ANCC and NAB, so you can earn credits while sharpening your investigative and quality improvement skills.
And here's why it ties everything together. Whether we're talking about medication errors, behavioral concerns, falls, or systemic issues like burnout or trauma, RCA is the tool that helps you learn, adapt, and build a safer, more responsive environment for residents and staff alike.
If your community is aiming for real improvement, not just checking a box, this webinar is a chance to dig deeper and walk away with strategies you can use right away. Registration is open now on the HealthCap Risk Management website.
That's it for this week's HealthCap Weekly Wrap. From prevention strategies and resident engagement tools to new treatments and practical training, We hope you found something useful to bring back to your community.
If you'd like to read any of the articles we mention or share them with your staff, you can find all the links on the weekly wrap post on Angie's blog at riskmanagement.healthcapusa.com/Angie's blog.
Thanks for tuning in, and we'll see you next week.